Welcome to Marin Voices and Views. With Lawrence A. Strick, I'm Peter B. Collins. Coming up in our second segment, MarinScope newspaper columnist Peter Richmond will join us to talk about his recent stroke. Along with one of Marin's leading experts on stroke, Marin General Hospital neurologist Dr. John Panagotacos. And I said it.
And well.
Hilarious.
Yeah, well, I get a much easier name, Peter, because we're pleased to welcome back Mayor Gary Phillips. Gary is a CPA, he's an avid pilot, and he was elected to the mayor of 2011. He's just completing his first term.
Right.
Welcome back. Well, not just completing. In November will be the end of your term, or next year will be the end of your term. But welcome back, Gary. How are you?
Thank you. Fine. Fine. Thanks for having me.
As you come to the third year of the term, talk a little bit about the highlights of your experience and what letter grade would you give the city government functioning at this time?
Well, thanks for asking, first of all, and thanks for having me here. We've done quite a bit, and we've focused our attention on specific areas. And at the outset, I said, look, we have certain areas that I want to make sure we don't take our eye off the ball on. And so we formed 7 ad hoc committees to cover some of the key areas, the long-term areas to take positions on and address in a meaningful way. And they are homeless and SMART and the pension, the downtown and facilities, sort of on and on. So we've got it structured, our approach structured along those lines. So again, we don't take the eye off the ball. We have council members that are chairing each of those. I chair a couple, but the majority are chaired by council members to give them the responsibility. And it's their baby, and I serve on each of them to provide some continuity. But we focused our attention on those key areas. And some that we're most concerned about at this point in time, spending our time and attention in a substantial way, are homeless facilities, which, as you recall, and we'll get into it perhaps later, but as you recall, we had Measure E was passed. The voters were kind enough to give us some funding so we can address in a meaningful way our police and fire facilities. And of course, SMART is coming to town, and I sit on the SMART board. We have a unique committee just directed at the city of San Rafael to prepare San Rafael for the arrival of SMART. So there are quite a number of areas, but those are areas, like I said, we want to make sure we don't lose sight of and give due attention to.
And a letter grade when you got there, and where do you think things
let me
stand
qualify. Are you talking about the mayor or the city council?
The functioning of city government and,
Sure.
and also just the fiscal picture has improved.
On both of those. The fiscal picture has improved, as it has in most cities, particularly in California, because the sales tax has increased, direct result of our economic conditioning improving. So we've been fortunate in that regard. It's not out of the hole yet, but it's certainly improving and gives us a little more latitude in areas that we want to address some funding. So that part's good. With regard to the grade, I'm intrigued by that. I'd be hesitant to give us an A because we still have some work to do. But I'm going to say that I've been around. I've been in business. I've been in a number of different situations, and our staff, the professional staff, and it applies to the departments, police, fire department, public works, etc. They really are quality people. I kid you not. They're heads up. We are proud, and I must say I put a great deal of faith in their performance and training and abilities and dedication to the city. I give them very, very high marks.
Mm-hmm.
Really do.
Well, before you go on, though, so does the Chronicle, because in this week's, and I'm not supposed to say what week it is, but in the recent 96 hours, the supplement to the Chronicle, they have a street date column that I've been reading for years. And this week, the dates for 4th Street here in San Rafael. Yeah. So I think we all need to be proud of that.
Right.
Gary, there's a recent proposal regarding housing issues, and this has been pretty contentious. There are people who are deeply opposed to what they call high-density housing. Mm-hmm. Mm-hmm. Now let's frame the discussion about this new proposal for Whistle Stop to build a 5-story senior center with 47 affordable apartments at its current location at 3rd and Tamalpais in San Rafael. Do you support this proposal, and what kind of reaction are you hearing?
Well, those are good questions because it's in everybody's front burner at this point in time. Whistle Stop had their first public hearing or meeting last night. About 75 attended, including myself. And it was pretty well received. There are concerns, and I share some of those concerns. The The location is the entryway to San Rafael, and so it makes a statement as you enter. And to some it makes a good statement, and some is not so wonderful. So I'm still concerned about it. We'll go through a process. Public hearing is required. It will then go to our design review board, our planning commission, then ultimately to the city council, perhaps in July. I've heard it's not scheduled yet. But it's interesting because I'm a big-time supporter of Whistle Stop. I think most of our community is, because of the service they provide to particularly the elderly. And this would provide housing, low-income housing, affordable housing, for at least 47, as you mentioned, that planned at this point. So I'm in favor of the concept. I do have some concerns about such things as parking, because there won't be parking provided for the public. There are about 21 spaces primarily for employees and others that need to visit there for official reasons, if you will. They've said that they are not going to allow residents to have cars, and we'll have to see how that plays out. But not so very long ago, they had 47 spots, and they didn't think that was enough, and they asked for up to 75 would be their preference. And so I'm still trying to reconcile 21 to 45 or 47. And it's this requirement that the residents not have cars. Well, people are going to visit, and service providers, et cetera. So I have concerns about that aspect, certainly. I have concerns about the height. You mentioned it's 5 feet, 66, or 5 stories rather, 66 feet. As a gateway entrance, I'm concerned about that. I'm concerned about the architecture, as San Rafael is the mission city. And frankly, this reminds me not so much of San Rafael when I look at it. So I do have some concerns.
The plan is partly driven by the SMART train.
Yes.
And it's going to run, SMART's going to run from Santa Rosa down here to San Rafael. We recently spoke to SMART's general manager, Farhad Mansourian.
Farhad
Mansourian. And he was pretty clear. He said that his business is building a light rail system, and his business is not building terminals.
Right.
And there was some blowback in the press about that. Is San Rafael going to be able to fund a terminal, or are we going to have a bare-bone platform, or how do you see that ending up?
Yeah, that's a really good question. You characterized it correctly. The initial plan, which is uniform throughout the track sites at this point, seemed pretty Spartan to us and not at all reflective of San Rafael. I sit on the SMART board, and I raised the objection there, and also when it came to City Council, it didn't seem appropriate to me, and I still feel that way. We have since provided the SMART General Manager, Farhad Mansourian, as you mentioned, what we think is a better appearing, it's not a station per se, but really a covering, much like you see at BART, et cetera. So we think it's much more reflective in design. They have said, SMART have said, whatever improvements you make in addition to what we're going to provide, you're going to have to pay for. So we've got to wrestle with that some. But I'm not satisfied at all with their design at this point in time.
There's some excellent faux exterior treatments available at Home Depot, Gary.
I'll look into that, Peter.
But it's a serious issue, though, because I think people were very surprised and upset about that. And he was quite clear that he's in the railroad business, not in the building business.
I mentioned I do sit on the SMART board, so I'm very familiar with Farhad and have a great deal of respect for what he's accomplished at this point. It's incredible. The guys are out there working 7 days a week laying track, and you won't recognize them one day to the next. So my hat's off to Farhad in many, many ways. In this particular area, I respectfully disagree, and quite frankly, he's been helpful to say, okay, let us work with our architects, being SMART's architects, and you guys. And I've asked Larry Paul, who is on our planning commission, as an architect and knows the city well, to help us come up with a design that's more appropriate. And right now we're costing that out, so we'll see where that goes, but that's where it's at.
Pardon me, another SMART issue is whether the whistle sounds every time a train comes through.
Right.
And there's a balance here of quality of life and public safety.
Yes.
It appears that you've brokered a pretty good compromise there.
Well, thank you for that. It was really the community that came together on that issue because we knew that there was a lot of concern about, as you mentioned, that the train having to blow its horn unless we made otherwise application to the FRA. And the community was concerned about the train starting at 5:30 in the morning and blowing its horn each time it went through a crossing or preceding a crossing. And so we had collectively 3 public meetings throughout the community, well attended, standing room only, in fact. And the community was very clear that their strong preference was not to have the horn blow. And we had a little bit of difficulty, quite frankly, in assessing what risk there might be associated with not blowing the horn. The horn's a safety feature. But our conclusion was, with the other amenities put in place with regard to the crossings, medians and so forth, that it would be sufficiently safe. And more importantly, I would suggest, because this is their business, the FRA, the Federal Railroad Administration, has blessed that approach. And therefore, we're in the process of applying for the quiet zones. City Council about a month ago passed that measure unanimously to request that the quiet zones be put in place. And the community is supporting that decision. So we're going to be moving in that direction, and I feel very, very confident that we will.
You know, homelessness presents somewhat of a problem here in San Rafael. The streets team, which employs homeless people, was renewed after a really successful first year. You've been fairly clear that Ritter House should move. And are you looking at a plan, or is there a workable plan to provide services that Ritter House now supplies folks in a place where folks who need the services could get to it?
Well, really good question, a compound question, I might suggest. There are 2 different issues, downtown street team and Ritter. Ritter, I believe, provides many services that are needed by those in our community. Not just the homeless, but more broadly, those precariously homed or housed, but also perhaps low income. And in our view, and certainly my view, we need to support that group as a community. We owe it to them. Some are more fortunate than others, and those that aren't, I think we should offer a helping hand. And Ritter is doing that firsthand, so we certainly support their objective. Now, to be clear, with regard to Ritter, I meet with their board on an informal basis half a dozen times a year. Very first time I met with them, they said, "We want you to help us relocate." So it was like, well, that surprised me a little bit. And I said that that's not our business of relocating businesses, be they profit, nonprofit, that's not our business. But I did say that we have a vested interest in where that might be. And so to the degree that we're able, we'll certainly accommodate and help them do so. That has not transpired yet for various reasons, but it's something we're still working on. So if we can help them to relocate to a better location for their operation, as well as perhaps reducing the impact of the downtown, then that's something that I think is a win-win for everybody.
Mayor Phillips, there's much more we'd like to talk with you about, but our time has run here, so we'll save it for a future interview.
Anytime.
I just want to close by thanking you and the council for canceling the contract for the red light cameras at 3rd and Irwin. And I really feel that you and your colleagues listened on that issue. And maybe that's just my fantasy, but I'm glad the red light cameras are gone.
And we did listen, sir.
All right. Thank you, Mayor Phillips.
Thank
Good
you.
to see you today.
My pleasure. Thank you for asking me.
My friend Peter Richmond returns to our program today. He's an ace realtor with Pacific Union in Mill Valley and writes a column for MarinScope Newspapers. Last year, Peter alerted us that domestic violence has become Marin's #1 violent crime. Today, he's here to alert us to the risks of stroke, as he experienced a serious episode in October of last year. Truly, it's great to see you here, Peter.
It's great to be here. When I think of the alternative, it's not at all appealing.
We're also joined by Dr. John Panagotacos, a neurologist and Marin native who's medical director of the Marin General Hospital Spine and Brain Institute. He has specialty training in stroke neurology and was named a top doctor by Marin Magazine last year. Welcome, doctor.
Thanks for having me.
Good to have you with us.
Doctor, can you give us the big picture about stroke in Marin? What is the type of population that's at risk, and what should people look out for if they think something might be going on that might be a stroke?
Sure, absolutely. So stroke in Marin is somewhat similar to stroke in the rest of the country. I think speaking for the entire country, there's about 800,000 strokes per year. It's the #4 leading cause of death in the United States, and it's the #1 cause for severe disability. So it takes quite a toll on our patients in the area, and also obviously economic toll as well. At Marin General Hospital, we see approximately 250 strokes per year. There are different types of strokes, which we can talk about. But in general, these patients come in with either bleeding strokes or blood clots and are treated in the hospital and usually discharged to rehabilitation facilities in the area.
Mm-hmm. So, Peter, tell us about your episode. You had a cerebral hemorrhage back in October.
Right.
Give us a quick summary of what happened and how you handled it.
I was sitting, I was home alone, and I happened to be, funny enough, sitting on the toilet. And all of a sudden I started having waves of numbness, first down my left arm, then down my left leg. Then my face got numb and it went across from one side to the other. And then the inside of my mouth started feeling like it does when you go to the dentist and you get an overload dose of Novocaine. It's like everything was just solidly numb, no sensation at all other than the numbness. And I recall having an out loud conversation with myself saying, asking myself, could I be having a stroke? And it seemed like I was, so I grabbed my cell phone. I'd crawled elbows and knees out to my home office where my desk was, figuring the landline doesn't drop as many calls. It's amazing this all goes through your mind when you're not even conscious of thinking of it. So I wanted to try and use a landline, couldn't get there, couldn't pull myself up to the desk. So I pulled the cell phone off my hip and called, and I said, I think I'm having a stroke. And 5 minutes later, the EMTs were at my house. Mm-hmm. And the next morning when I woke up in Marin General, the doctors who'd been assigned to the case were sitting there along with this fellow from the EMTs, and it was like they'd rehearsed the way they were going to say it. They, in unison, came out and said, the phone call you made last night saved your life. If you hadn't called, you wouldn't be here having this conversation. And from what I've learned from my neurologist, my first appointment with him last week in the city, what they were saying was only too accurate. They said that I came very close to dying, as it turned out.
Mm-hmm. What led you to choose going into the city? You ultimately treated at Ralph K. Davies, right?
Yeah, the Davies campus of CPMC. We started looking after we'd been in Marin General for, I remember 3 or 4 weeks, maybe a little longer, where we should go in terms of rehab to continue working through this. And 2 of the best ones in the country are in San Francisco, one of them being CPMC. So we looked at both of them, discussed with our doctors, family, as well as the people on our case. And they both had to accept you before you couldn't just show up the door and say, hi, I had a stroke, let's rehab. Mm-hmm. And we decided on CPMC, and the care was excellent. The care at Marin General was good too.
And Dr. Panagotacos, tell us about the stroke rehab services and other services that Marin General offers. And if I can tag on to that, I'm also interested in any community education services that you offer to help people who might be vulnerable to stroke and their families learn more about it.
Sure. So Marin General Hospital is a primary stroke center, so designated primary stroke center. It's received multiple awards throughout the years for its excellence in care and stroke care. And Peter's story is not different than many other stories where a phone call is made, EMS is alerted, and the patient comes to the hospital. What that triggers is a whole cascade of events within the hospital, the emergency department being prepared for a stroke patient coming in, the CT scanner being prepared for the patient to get an immediate CAT scan of the brain, drawing blood work immediately, notifying the neurologist and the pharmacy. So there's lots of time-dependent issues, and only stroke centers, designated stroke centers, are really streamlined and equipped to manage stroke because it's really a time-related issue. So that's one of the main things. The issue for the treatment and rehab that occurs in the hospital, initially patients can receive a clot-busting medication called TPA. That medication can only be given within the first 3 to 4.5 hours, depending how old a patient is and depending on what the circumstances are. Not all patients are eligible for it, but because of that time window, this urgency to be treated quickly is very important. So that's one of the most important things to know and the reason to rush into the hospital. Treatment occurs beyond that in the hospital and then transitions into physical therapy, occupational therapy, speech therapy, advice from dietitians that we have in the hospital, and then discharged to a local rehabilitation facility, either here in Marin or sometimes in San Francisco, like you went to. In terms of the education happens within the hospital. Patients and family are given education from the nurses regarding stroke risk factors and management. But a lot of that education, unfortunately, sometimes needs to be handled beforehand. Is how to prevent a stroke. Once a stroke has happened, it can be quite difficult to recover from a stroke. So we do have lots of programs out there. Marin General Hospital offers lectures throughout the year. I give many of the lectures to the community regarding stroke risk factors, and management. And May is a National Stroke Awareness Month, and the hospital always has lectures at that time. Mm-hmm. One key piece I'll mention is that there's a very comprehensive booklet for stroke care, and it's available online at MarinStrokeInfo.org. So that's MarinStrokeInfo.org. And going to that website is a downloadable document, multiple pages. I believe it's 70, 80 pages long, in an electronic version form, but there's also a paper version form that could be obtained by calling the hospital and asking to speak to our stroke coordinator and getting that sent out. So it gives all sorts of information on preventing stroke, treatment of stroke, and then what to do after a stroke.
Mm-hmm. And Peter, you told us a kind of moving story a little
Mm-hmm.
while ago that one of the key points in your rehabilitation was learning to go upstairs again.
Yeah. As part of the treatment and the rehab, I mean, first of all, just to digress briefly, I consider the reason we're sitting here having the conversation is because I was very fortunate. I was lucky I got to make the call. If I'd been asleep when it happened, I wouldn't have woken up to make the call. I was lucky I had excellent medical care at both locations. My wife has been a hero. And just constant flow of support from friends, from relatives, from co-workers. Every day, most people around this time of the year have like a wall of all the Christmas cards they've got. I had an entire wall in my room at CPMC covered with get well cards.
Sure. Mm-hmm.
My cousin from Boston called every day to see how I was doing. And I was very fortunate to get through. I also, as anybody who knows me can tell you, I'm a fighter. So when the morning after the stroke happened, I woke up at Marin General, and the doctors were telling me how bad it was, and that it could be a long and very difficult, if not impossible, rehab. I won't get into the same language on the air, but I rather pungently told them to forget about it. That basically I happen to be a fighter, and I was going to walk out of there on my own, which is what I ultimately did.
Mm-hmm. And learning to go upstairs?
Learning to go upstairs was part of the excellent treatment I had. They had a fabulous set of physical therapists. And normally when they teach you going upstairs, they teach you the way you did when you were a kid. You put one foot up and then the next one's right next to it, then one foot and the next one's right next to it. So the second day they were doing this, we were in a stairwell where the stairs are a lot steeper than they were in the PT gym room. And there's a lot more of them. And I started up, and immediately the first step, I went one with the next one over, just like an adult would, and the therapist said, "Whoops, you made a mistake." And I said, "Yeah, I did, but you know what?" I said, "It shows me that my muscle memory is still there."
Yeah,
there you go.
Yeah.
And then it occurred to me how quickly in life something you got physically can disappear just like that, and you'll never get it back. And you really should take advantage and use it all the time. And when that thought hit me, I just broke down and started sobbing on the stairs there. It was
Doctor,
too obvious.
I can't imagine the cost of going through medical treatment like this. You mentioned, Peter, that you received Medicare, and that's thankfully that's so.
Yeah.
In my business, I see medical bills all the time, and a lot of times I see that the insurance company will pay one amount, but there's excess billing that goes on to that's patient responsibility. Do you think that in your job that the insurance companies are adequately compensating the doctors and the hospitals for the treatment, or laying too much onto the individual people who are suffering their strokes?
Yeah, I mean, that's a difficult question. All cases can be different. In general, stroke is a condition for older patients, and most of our patients do have Medicare. So not as many younger patients will have strokes, and something to recognize is that every decade the risk of stroke actually doubles between your 40s and 70s. So that risk really goes up. So most of our patients are covered through Medicare and end up not having to be encumbered with a heavy bill afterward. But the way hospital payments often work is that the hospital receives a bundled payment for a particular diagnosis. So a certain dollar amount is allotted for that condition, and if the condition becomes quite complicated, the hospital can lose money in that respect. So it's a complicated question, trying to streamline processes. I think right now stroke is not something that's too cumbersome for patients.
Just about a minute remaining. Peter, can I ask you first for a couple of quick tips for our viewers from what you learned from this experience?
Yeah, one of the reasons I was able to make that phone call that they said saved my life is somewhere out in the ether, I had apparently heard an ad or something from the Stroke Society, whatever it's called, or seen it on TV saying the signs of stroke. And when the first waves of numbness hit me, as I say, I sat there and said to myself, could I be having a stroke? And I immediately called the 911 people. Mm-hmm. And if I hadn't heard that, I probably never would have thought about it. I probably would have figured, yeah, something odd.
Well, and maybe this show will perform that function for some of our viewers.
Yeah, hopefully. If it saves one person, it's worth it.
Right, I think maybe I would just add to that. That's exactly right. So I think maybe a take-home point would be there's a mnemonic called FAST, F-A-S-T. Yeah. So you'd want to evaluate your face, whether there's a droopy face on one side, then put your arms out in front of you like this to see if there's any drooping on one side. Then check the speech to make sure there's no slurred speech or abnormal speech. And then note the time that the symptoms started so that when you go and see the doctors in the hospital, you can tell them what time it started so you might be able to receive that medication.
Very helpful. FAST, even I can remember that. Dr. Panagotacos, thank you for being with us today.
Thank you.
And Peter Richmond, thanks for staying with us.
Thank you very much. Thank you.
Good to see you both.
Thanks.